This is a new setting, so I'm not sure if this audio video setup will work. I hope it does. So guys, welcome back. This is Aditya. I've completed my residency in 2025. It is November 2025, I think. And after that, it was mayhem. I'm sorry. So I learned a few things over the course of residency in how to study, because my preconceived notion was that you should study for 10 hours every day and that's how you actually learn. But I was so very wrong. Learning happens so there is no strict way and rules for learning. You can learn in OPD, you can learn in OT, you can learn during exam preparation. Learning just happens and you can't really control it, but what you can control is how you learn. Am I making sense now or not? I don't know. So here are a few things which helped me and which I think will definitely help you if you're going through residency. The first thing, consistency beats intensity. Now, like in most walks of life, consistency does beat intensity. So what I mean by consistency is reading consistently, be it for 30 minutes, 40 minutes, 45 minutes, 1 hour, 2 hours, whatever time you get, just read and make sure you make that time for yourself to read. Because residency is such a period, especially in actually all 3 years, honestly, you won't really have a lot of time because you have so many other commitments. You have to see patients, you have to take rounds twice a day, you have to operate if you're a surgical resident or an orthopedic or a OBGY, whatever, but you have to operate, you have to take rounds, you have to present rounds to faculty, you have to see patients yourself, you have OPD, you have so many things. You have clinical case presentation, you have seminars, you have thesis. In all this mess and jungle, you have to carve out time for studying. So when do and how do you carve out this time for studying? So honestly, I think everyone has obviously 24 hours. During OPD sessions, during OTs, while shifting patients, you have those dead space of time. Use that. You can solve MCQs, you can carry your textbooks or iPads, whatever, or even read PDFs from phones. Use ChatGPT to solve any doubts. That's how you learn actually. Now the second thing is your patients are your teachers. Now each patient is different. Each patient will have a new story within themselves, different history, different clinical examination findings, different management protocols. So make sure you examine each patient, take proper history and read that case then and there from a standard textbook. Now the third thing is having a doubt folder. Now this thing helped me a lot. So by a doubt folder I mean using a pocket diary, using the notes app, using WhatsApp, voice memos, whatever helps you jot down that doubt which you have during rounds or while studying. Jot down that doubt and make sure to search that and clarify that doubt, be it from a senior, be it from a faculty, be it from the internet or textbooks. That's how you will plug that gap, whatever you have in your brain, and neuroplasticity will occur and you learn new things. Now the third thing is teaching is the best way of learning. Teaching. Now this is my favorite thing, because honestly when you teach someone something, you try to actively recollect those concepts or those things which you have in your mind, and in truth they really test your own knowledge. And if you have a doubt, you can obviously read it later on, but during this way of teaching you can obviously help others as well as or test your own concepts at the same time. That's a form of active recollection. Now the fifth thing is learning from each consultant. What I learned over my short career as a surgeon is that each consultant will have their own array of skill sets. Someone will be an expert in robotic surgery, someone in laparoscopic surgery, someone will be very good with dissection, someone will be very good in teaching while operating. So take the best things from each surgeon or each consultant, because they have condensed knowledge that they have accumulated over years and you get that free access to that knowledge. So it's really great thing that you have at your disposal. Now bonus tip is to be prepared. So if you have an elective OT, read the operative steps and the clinical findings and the topic from a standard textbook, and that's how you'll amplify your learning process. So I hope this video helped you. It's just restarting on YouTube, and I hope this series about residency, about medical education will help you. Please do check out the other videos on this channel. See you again. Ciao.